public hearing, but we're going to focus initially on questions around the budget, but we will be kind of mixing them up at times because, of course, it's difficult to separate the finances from the policies. I'm going to start with some general questions about the budget allocations. Could you please talk us through how the budget allocations for different expenditure within CLS was determined?
I think perhaps CLS is a lot more straightforward than other departments because of the way that we operate and the funds that we administer as well. Mm-hmm. So, of course, there was discussion around the Council of Ministers table around the efficiencies that we need to deliver across departments, and CLS is playing its part, as other departments are, within those efficiencies. And I'm going to have to ensure that we can meet and do what we need to do and are obliged to do while doing that. But also taking into consideration the CSP priorities, and in particular my own priority for the introduction of a higher minimum wage. And that then I think within the government budget, the key point around social security would be around the change in the state's grants that will be going into the social security fund this year. I think that is different to what was proposed by the previous government on the basis that this is ring-fenced funding, and it is the purpose of that funding to be used along the same lines as the purpose for the Social Security Fund itself, because it's around both protecting jobs, protecting employees, and also ensuring that employees are better paid.
Okay, and I think we do have
come to that,
questions on that a bit later. Yeah, thank you. In terms of business plans for the work that you're going to do, we note that a departmental business plan has been published for CLS, and we're grateful for that. Is there a projected business plan for 2025 which has informed your funding proposals?
So I will now be working with the Interim Chief Officer to do a business plan for the remaining 18 months of the term of office. I think that will be more useful for me to do than just a business plan for 2025, because then I can be absolutely cognizant of what is deliverable in that term of office. Obviously, I have had conversations with the former Chief Officer and the new Interim Chief Officer to ensure that my priorities can be delivered within the budgets. So we'll be finalising the departmental business plan to say how we will be doing that within the coming months before the end of the year.
And why has it been done that way around? Why was there not a forward-looking plan and then the funding following that, the funding bids?
I think you always start with strategy and then how much money you've got available, and then the business plan follows when you actually know your budget and how you need to cut your cloth accordingly. The department are very aware of my ministerial priorities, and they know where the focus needs to be. I think also CLS is slightly different to other departments as well in terms of its role in administering the Social Security Fund in itself. So that then doesn't really form part of the government plan budgeting process, if that makes sense.
So you say the strategy came first and that contains your priorities, but how is that communicated to, say, your officers and other states members?
I can, maybe the officers could also speak to how, because I'm quite clear, I think, around my ministerial. I know that we didn't need to have ministerial plans, but I did have the list of ministerial priorities, which I forwarded on to the panel in confidence. That's where really I needed to start. The conversations then that I had within my weekly ministerial team meetings were around, are we confident that the resources that are within the budget will give the department the level of resources that we need to be able to deliver, bearing in mind, obviously, we've only got so many people to deliver those priorities. So it's about being realistic about what we can achieve in this term of office, and within the budgets that we have available.
Sure, and in terms of the strategy, then the money, then the plan. What was in your kind of strategy at that level that perhaps there isn't money for, that you can't see through in a plan?
I think for me, it's not necessarily the funding, but the timing and the actual resource potentially outside of the department as well. So, for example, law drafting time, for bringing in legislation, but also ensuring that when we bring in legislation, we're doing it in a really measured manner so that we're not bringing in too many changes, particularly in the area of employment. My area of focus, as in the Common Strategic Policy, is around raising that minimum wage. I think it's no secret that I would like to make lots of changes to the employment law, but I can't do all of that at the same time. So because that would have an impact on employers as well as the employees. So it really does need to be a sustainable approach to change. So in that case, I'm actually quite happy with where we've got to in respect of what I can programme into this particular term of office, given the resource constraints that I've got.
Yeah.
And
Was
the staff, which tend to
yeah.
be about staffing and staff time and expertise more than anything else.
Sure. Was there anything that was kind of borderline, something that you would have liked to do, and maybe there might have just about been enough resource, but you decided actually no, that's not the priority?
I think one of the key areas that we will be looking at into the future is we've got obviously the income support budget and how we can best ensure that people on low incomes are supported. I am hopeful that the work that will be done on minimum income standard will actually inform some of that work. I'm also cognizant as well about pensioners and people's expectation of the state pension and what that should give them, but also then how income support then supports lower income pensioners as well. So there is a lot of work that needs to be done, but being realistic, it wouldn't be appropriate to bring in a raft of new policy staff because you do need specialisms and expertise to look at that. So one of the key areas I'd like to look at in the future, it would be around where pensioners who start paying income tax, there is that cliff edge of benefits. So you are either eligible for everything or what seemingly nothing. But that piece of work to enable us to do some work to see what that smoothing out process would be, that's quite a significant piece of work. So.
Would it not be worth buying in the policy resource? If you said actually the funds aren't the problem, it's the people resources I'm hearing, would it not be worth getting some temporary policy resource to do that?
I think actually what we've got is quite skilled policy officers that know their areas and know the legislation, and to bring somebody new in and up to speed might well actually be a waste of resource because you'd spend so much time teaching somebody around how everything works.
Incredibly nuanced.
I mean, it is an incredibly nuanced system, so I think that may actually be a false economy as well.
And you mentioned that some work you might like to do in the future around the income support budget and how that's spent. And I recall in the Assembly, in response to some questions, you mentioned something about homeowners and maybe looking at where, how homeowners could be helped by the income support system. Is there anything in the budget, the current budget, that would address that, or do you have any future plans to address that specifically?
Not at the moment. When I looked at what we can do with income support, and I raised the question around, okay, well, what would that look like? Unless we've got very, very strict criteria, we may well end up with something that is unaffordable for the island at this point in time. So that was one of the things that wasn't prioritised with regard to that the income support budget that we have. Of course, to increase the income support budget would be an increase in revenue budget. If we have an increased income as a government, then that's something that we could look at. But for me, and I think we need to remember that the majority of people on income support are working people. So that is really why I wanted to prioritise where we're going with minimum wage as well.
Do you think, given the cost of living crisis at the moment, that you might return to that decision, given that so many islanders are struggling and might need this additional support?
Yeah, I mean, let's be clear, it's not a decision, it was a decision not to prioritise that piece of work. I think, again, the minimum income standard piece of work will tell us potentially a lot about cost of living and what it costs to live on the island, and because I think, and Sue, I know you will step in as well, because it does look at the benefits system as well, doesn't it, when you look at the amount of income somebody requires.
Sure, thank you.
If I could just make a point about homeowners, just to clarify for the panel and for the general public, that obviously homeowners can access income support. I think what Lyndsay is talking about is mortgage payments. So at the minute, the only support for mortgage payments would be a very kind of short-term emergency support. We would do that. It's very rarely done because, in effect, the banks tend to kind of come up and provide people with mortgage holidays for short-term following a death or a redundancy or collapse of business or something like that, yeah? But we do have the ability to do some limited mortgage payments, but I think you're talking about a big increase in income support. That would be if you were to create a system, as you have in other benefits in other countries, whereby you're actually paying supporting people with their mortgage payments, per se, yeah? That's not something that's ever been done in either income support or in other systems that Joseph had before. That would be a big change. But homeowners absolutely can access income support today. And
I think that's a really important clarification there that Sue's made, because I think that is a common misunderstanding and misconception around the availability of income support to people who are homeowners. And then I think there's some other work, and again, I have asked the communications team to communicate out more broadly to people so that they know that they can apply for income support. Sure. I think that that's really important. People shouldn't be automatically discounting themselves and saying, oh, I don't think that I'm eligible for
that. It's a lower level of support though, isn't it, if you're a homeowner?
Yes, because it would be, and maybe we could provide the panel with some more information.
I understand it. It's for the public, I guess. Okay, I would like to ask about a letter that the panel sent you, and we received a response. We were asking about staffing and restructuring within your department. And I think you stated that going forwards, your plan is going to be 2 rather than 3 director posts. Could you give some detail on how this restructure will enable savings to be made without impacting on the service delivery of your department?
I mean, those savings are obviously at the highest level of the department. I have had conversations with the chief executive. We are in total agreement that we need a chief officer for this particular area. So it will be at that kind of lower level. There'll be a flatter structure. Mm-hmm. I need to work with whoever takes on the permanent role as chief officer to ensure that the department is able to function. But ultimately, as well, it's the State's Employment Board matter for staffing. But I'm very clear in my role as Minister, with the conversations that I have with senior leaders, that what I want to see within the department is more of a culture change, so that what we see is people that are coming into the department asking for help, they get solutions to their issues. Whether or not the department can help them through the funds that we support, I think we always need to be looking at what the solutions are and making the right connections with other government departments, mm-hmm. working across government departments. So, I mean, the bulk of the transactions and the work and the delivery mm-hmm. is at those kind of the lower grades that aren't then currently impacted by the plans of the State's Employment Board.
Okay, so no redundancies of frontline staff within your department?
That's not currently the intention. I don't know if Sophie wanted to speak to that as well.
No, that's it. I think, we obviously know we have to make savings, which is part of that commitment, but, and we think, sometimes there can be appropriate ways we can manage vacancies in the department and look at how we move people around. But at this stage, we're not, we know that our frontline services are really important. Having that customer focus is what is really important for us, and we're really making sure we prioritise our support in that area, and especially as we move to the new building and things like that, that's an area we're really making sure we carry on investing in.
I think it might be worth you, Sophie, talking about, I know when Sophie did her last quarterly update to staff, you did some helpful talk about kind of owning the customer, which I think goes around real service and ensuring that people are dealt with well.
That's it, in line with the Minister's priority around almost making sure that we have really, good customer satisfaction levels within the department, and it's always really good to hear about that individual service, but what we felt like we really want to work on upping to as high a level as we can is where people need to perhaps benefit from some different services within either the same department, whether that be income support and back to work, or long-term care and income support, these sorts of areas, making sure that actually we are as joined up and proactive as possible in terms of really focusing on resolving first time for a customer, and that then also spreads out to the wider government piece, where I think being in one building will really help. But that for us is a key objective for the department in terms of looking at that thinking twice when we've got a customer, whether they're with us in person, on the phone, on email, actually thinking, have we really resolved this for a customer now? Here, what we don't want to be doing is sending someone between different teams. We're not saying that people can be an expert of all complex areas in the department, but actually we can make sure that we put the customer at the centre and we do the work to make sure we resolve it. That was one of the Minister's priorities, and actually that's been really well received, that colleagues across the department are very bought into that, and we're having really good examples weekly of where that's working well.
I think in a previous hearing you mentioned, Minister, you wanted to, and thank you for that information, you wanted to communicate better with the public about what was available. Have you considered how communicating better might result in more uptake of services, and what impact that might have on your budget? And do you have a forecast of how that might, what that might look like?
I can always I haven't had a forecast of what that might look like, but I think it's important to say that the income support, and you can talk through the technicality of the income support budget, but you do. I think Sue actually explains it better, I think, than I can.
I think the Deputy's point is that if we were to communicate, if there's unmet demand, and we have a very good communications plan, we'll create extra demand, which we'll have a statutory requirement to meet. And which
so do you know what the unmet demand is?
It's really hard. So the minimum income salaries actually might be
that will help.
Yes. So that's a CSP. Sorry, not CSP. It's a budget initiative under the Minister for Economic Development. But this minister is very keen to see this work done. So this is where you look at people's household budgets, and you work out a kind of a basic budget, if you like, a basic weekly budget. And you have to do it for a particular type of household. So it's quite a complicated piece of work. So you have to do it for a single person, or a couple with a child, or a pension, where you do different types of people. That would give you a feel, which we don't really have at the minute, for what kind of like a basic standard of living would look like, that would be kind of people would feel would be okay, and then you could work against other statistics that we do have about what people's actual incomes and then kind of compare those two together. So at the minute, I think we don't really know. I'm not sure how anybody could work out what the level of unmet demand was. the technical answer to what would happen if we got a lot of extra demand. The income support budget has got a certain amount of flexibility, and it needs to have that from times, anyway, to deal with unseen things. And then the minister can call on a contingency fund if she needs to. As I say, it's a statutory requirement, so you have to have some kind of backstop to kind of like maintain your budget payment, your benefit payments in November, December if you've used your money up in October.
And take the point about it being a statutory requirement, I don't think we'd want to be in a position as a government where we think that we shouldn't be communicating out to people what they're eligible for on the basis that we're worried that too many people might come through the door. I'd be actually more worried if what we find is that there are lots of people that are currently eligible that aren't claiming. That would point to all sorts of problems and issues. And I'd be worried then about the effect on other government services as well, because what effect has that had on people if they are living in with a low income, lower than what they'd need to live
savings
on.
overall might still result, even if there was an increase in accessing health services.
So I was just going to also say what I think though is that actually for us this is really important that we try and make sure there aren't gaps. So we're doing quite a lot of outreach work. We work closely with a number of different charities who know about our services and who we kind of partner up with. We do events such as Closer to Home, going out to the community. So trying to reach those people through different channels to really try and make sure that those people who might not naturally be the ones who are coming forward, we've got really strong relationship with partners to try and, where possible, make sure that people are not sort of falling through the cracks and not knowing about something that they are eligible for. So I think we are doing quite a lot of work in that area already, but that there's always the risk of things that people who haven't engaged with anything.
Thank you, yeah. And Minister, I'm interested in this work you're doing on a minimum income. What's the ultimate outcome of that work that you're envisaging? Have you considered things like a universal basic income for some groups, or a basic income for some groups, or something that's more universal that might replace the income support system in future?
I haven't considered a universal basic income at the moment. I think that the minimum income standard piece of work will be a key piece of work because it will inform things like income support levels and also how we set our minimum wage into the future to ensure that it is suitable for the island. So I'm actually really keen to see that piece of work come to fruition so that then we can learn from that and see where there might well be gaps. I think that's one of the questions that I ask fairly regularly is, where are there gaps in what we're providing? And back again, I think to the uptake of income support or people that may not be claiming when they're eligible, part of that is to do with perception, and I really want to break that down. We're a high cost island, there's a high cost of living, and income support is there for a purpose as the safety net for all islanders.
Do you want to ask that one?
Yeah, could you just confirm you've said there will be a new chief officer. What timetable are you working to?
At the moment, I've got a very capable and competent interim chief officer, and I will be liaising with the chief executive officer around the timetable for the recruitment process. Obviously, the recruitment process isn't something that I'm responsible for or manage. That's something that is the State's Employment Board's responsibility.
But you don't have a timetable yet for when that position might be imposed?
No, but I will indeed be chasing that up.
Okay, good, thank you. I've got one question just on the points you've made so far, which is about efficiency savings. You've said there won't be, obviously there's formula-driven funding, so you're not going to make efficiencies there. You're not going to make people redundant on the front line. Where are those efficiency savings going to come from?
I think Sophie's actually best placed because she's the one that's given me confidence around the departmental budgets.
That's it. So I suppose from our perspective, we are going to look at at a director level, as we've already talked about. We have actually been managing vacancies almost over the last few months, knowing that we're going to need to make savings for 2025. It wouldn't, be fair to me to go on into the actual specific detail of individual sort of areas and roles, but we're confident that we can make the required. We've known now for a little while what our commitment is in terms of what roles we need to save and to what financial value, and we've used that opportunity to look at some different roles, but a significant one. We're quite a small department compared to some others, so actually for the from a sort of the director level post will be one of the most sort of visible changes.
Do you have a cash savings target?
Yes,
That's in here.
we've got
If it's in the budget, then
Yeah.
Yes, it
that's
is,
fine.
yeah.
Fine, doesn't matter.
200.
I think the thing is, from me as ministerial level, when I've asked the previous chief officer and the interim chief officer, do the savings present us with any issues or problems? The answer has been no. So I've been satisfied from the conversations I've had with the senior officials that they have things in hand to avoid situations of redundancies, but also ensure that we can make the savings without seeing that reduction in service, and in fact continue to improve the service that we're giving as well.
Does that suggest that there's a bit of flab and actually that there could be bigger savings to be had?
That's not what I've been told by officers. So, but I think that's part and parcel as well of doing business planning and ongoing and long-term business planning. But it's not for me to run the operations of the department. It's for me to give ministerial direction.
Can I move on to the...
I've just got
You-
one
you
more
want
that I
more?
want to
Okay,
ask.
sorry.
A general one about the previous growth bids that were cut by 20%. And I'd like to ask about those growth bids. Are there any that, even though you haven't had the additional 20%, that you've managed to find that funding for within your budget, or any that you are still carrying on with in that way?
Yes. So I was just trying to remember if this was a growth, the terminology. So one thing I was keen to ensure was protected was the money for the housing advice service. That's not just because they provide incredibly good support for housing, but also part of that service is our critical support team. I was going to call them unit. The critical support team provide such a valuable lifeline really to people in really awful situations and are dealing with day-to-day incredibly urgent issues. So for me it was really important to ensure that that was protected.
Okay. Something that the panel received a briefing about recently was the Connect Me project, which, as I understand, was one of the projects that was subject to that 20% cut in their ongoing budget. Can you just give your view on that, and on that project, how valuable you think it is, and whether you think it should have been cut?
I think the project has, or the grants programme there has seen some really good outcomes. The reason why, I won't say comfortable, but I could accept the cut in relation to that is because what we're talking about there is small grants for projects that they're projects that would have to apply to a grants programme, so that the small grants were never guaranteed. So it may well mean that some smaller projects don't continue, or we can't fund as many smaller projects, but there's nothing there that won't be funded that was kind of ongoing or continuous funding. It would have been added extras.
Okay.
The Social Security Fund, so obviously there's been a proposed reduction in the grant to the Social Security Fund in order to fund the incentive schemes to compensate for the living wage. It's £10 million a year for 2 years. What's your assessment of the effect that has on the Social Security Fund?
So the advice that I've had is that the long-term impact on the Social Security Fund isn't a large kind of, it's not an ongoing kind of long-term impact. £10 million is a lot of money, but in the whole context of the whole of the Social Security Fund, it's actually a small amount in that context. So I think for me, the benefits that we'll derive from being able to deliver a higher minimum wage and support businesses and support our economy in doing that, so that we're transitioning to more of a living wage economy, that outweighs the not putting that amount of money into the fund at this point in time. I think also I am quite careful as a minister about how we use the fund for other things, and I have asked officials at Revenue Jersey, for example, how much might be owed in debt by unpaid contributions into the fund. So there's other things that we need to also be doing to ensure that the fund is receiving the money that it should be receiving. Likewise, I challenged the department on the administration costs attributed to the fund from the department. So I am doing the best that I can to look after the fund, and I am assured that the reduction in the state's grant to the fund won't have a long-term effect on the security and the sustainability of the fund.
Did you fight it?
I had conversation in the Council of Ministers about other things that we might be able to do. I felt comfortable as Social Security Minister to be able to make this change. It is a change to legislation to enable me to do that for 2 years. I feel comfortable on the basis that it is being used for the purpose that is aligned to the purposes of the fund. I also feel comfortable that I have had conversations with the economic development team, and they understand that that's what the money is to be used for. And also I'm comfortable that we have enough safeguarding within the change to the legislation, which ensures that if the money isn't used for the purpose that we are not putting it into the fund for, that it will then be put into the fund.
Would you be happy to see further withdrawals from the Social Security Fund to cover budget shortfalls?
Not if it didn't align with the purposes of the fund, no.
But the purposes of the fund are to support benefits in the future, not to cover budget shortfalls. And the Economic Development Minister wrote a response to a written question from me, making clear that the reason for this was a budget shortfall. They couldn't.
I would disagree with that terminology. These aren't budget shortfalls. This is a specified suite of
But the
programmes.
reason for using the Social Security Fund was because there was nowhere else that it could be found.
Yes, but the reason for using the Social Security Fund is because that is absolutely in line with the intent and purpose of the Social Security Fund, and this is about protecting workers and also protecting jobs.
Do you think there should be a policy going forward to specify what the Social Security Fund can be used for, other than the benefits which it's designed in law to do?
Well, I think the legislation is there, and then it is incumbent on us as states members that if there is a change to how that is used, it will always go through the Assembly. But at the moment, that's my position around that particular reduction in the state's grant. But I don't foresee making any further changes at this point in time.
So last year you voted against an equivalent reduction in the grant, even though it was going to be repaid in the future. There's no repayment mechanism this time. So what's changed in your mind?
The previous plan wasn't aligned with the purposes of the Social Security Fund. This is ring-fenced funding. It's going to be used for a purpose that is, I believe, aligned with the Social Security Fund. And it should lead to higher wages and higher contributions into the future as well.
Can you actually identify where in the remit of the Social Security Fund, written in law, what the benefits are for, how that would apply to this grant?
Of course, the Social Security Fund is there for working age benefits, pensioner benefits, to ensure that people are looked after financially. At the end of the day, people of working age and future pensioners will be financially better off as a result of a increase in the minimum wage and us moving towards a living wage economy for the island.
I'd like to ask how you're going to measure and indeed ensure that the outcomes are there for what you're actually using this money for.
It would be for the Economic Development team and the Economic Development Minister to measure the outcomes of their programmes. I think...
Don't you need to have confidence that that's happening though? And do you have confidence?
I think my role has been to get regular updates from the team up to us making this decision about how we were going to fund it. I've had several briefings from the Chief Economist. I have asked them challenging questions around what outcomes might be. And I think that was my role, to have that voice around the Council of Ministers table as well, around what that package looks like and what ultimately gets approved by the package. Then the administration of the package and the delivery of the package is absolutely within the remit of the Economic Development Minister.
So are you confident that the intended outcomes will be achieved?
I had a briefing on the proposed package this morning. I was pleased with that briefing. I'm pleased that the officers working on it that they are looking at the key industries that may be affected, but also general productivity as well. So I am as confident as I can be that the intentions of what is being used for are correct.
But you're not arguing, surely, that the amount of money that will be delivered in productivity improvements will more than compensate for the amount of money that has not been put into the fund through the grant?
I haven't seen that level of modelling. No, not into that. Not that many.
So there's
years
a net loss to the fund
into the future. There is a net loss within this two years to the fund. I am willing to put up with that net loss on the basis of the gains that we will have for the community.
Moving on. The implementation of the living wage and its effect on care homes. Have you thought that through, and will there be support for care homes?
The care homes will, of course, be eligible to apply for that package.
Which is productivity related.
Not all of the package.
No.
So I think I need to leave it to the Economic Development Minister to talk about what the whole package looks like, because it's not my package, it's his package. I'm helping to make the money available to enable economic development to undertake that work.
It's been marketed as productivity, but okay. Carry on.
But obviously the care sector as Social Security Minister is something that I'm very cognizant of. I'm also responsible for the long-term care fund. So there's other work that we would be doing in line with the long-term care scheme, and also aligned with the work of the Health Minister as well, around those kinds of areas.
So having seen what you've seen, you are happy that care homes will not be disadvantaged by the living wage proposals?
Yes, yeah.
Okay. Do you want to do?
Yes. Can you talk us through any specific changes you're considering in your review of working age benefits, please, particularly for supporting working parents?
I am currently looking at how the current rules for the parental benefit affect parents. It's quite complicated the way that the parental benefit works because it's reliant on contributions records. So I am aware that there is an issue for parents who perhaps have their second child fairly shortly after their first child or their third child. They then don't qualify for parental benefits because they haven't got the right record of contributions. Currently, they are getting home responsibility protection credits for that cover them for pensions. However, it doesn't cover them for the working age contributory benefits. So that is one thing that I've already asked the team to do some work on, alongside some kind of broader work around contributions and relevant quarters, which is always very complicated, but probably archaic now because it looks back a certain number of quarters, I think from before we had paperless systems and electronic systems.
Yes.
Obviously, I'm pleased that I've been able to lodge before the end of the year the support for parents who have children born preterm, as well as support for people who have parents who have stillbirth as well.
Thank you. And in terms of the changes around different quarters and the parental leave, what's your time frame for any legislation that you might need to bring to change that?
I'm trying to remember where that is in the in the spreadsheet that we've got.
Ministerial plans are a good idea.
That's the thing. That is exactly it.
The minister's asked to look just at the HRP protection at the minute, which is limited, but also to have a wider view of the way in which all working age people sometimes don't qualify for something because of a short gap in their contribution record, yeah? And also the way in which it works for migrant workers who are here for some months of the year, they're not here for other months of the year. That is quite a big piece of work. The current set of rules have been in place since 1975. We've reckoned that they were set up before they had computers, so that you had time to kind of like do the paper books, yeah? We don't need to have that gap, but you have got to decide what would you do instead. Obviously, the fund is currently balanced by the idea that a certain number of people will claim working age benefits each year. If you made the rules much more generous or much less generous, that would affect that balance. So the question is, what do we look at? What do we have which would give us something similar? So there's an idea of you have made contributions. Mm-hmm. You're not somebody who's not been worked here for a long time. You've made some contributions recently, but perhaps not in such a short, specific. We look at a specific 3 months. Yeah. Mm-hmm. If you have found to miss those 3 months, you don't get something in that 3 month period going forwards. But it's for next year. The question about time, it'll be next year.
Yeah.
There's also I'm aware for. Just trying to there's so many facets of social security. So for parents who have children that have the care component, the level of care, currently home carers allowance. I know that there was plans to legislate so that parents with 2 children, say at a level 2, would then be able to claim home carers allowance. I am making ministerial decisions to enable those parents to claim home carers allowance. To wait for the legislation enables me to do that. So it means that I don't necessarily need to bring that piece of legislation in and wait for that to be done. The difference between that and the parental benefit is I can't. legally, there's no way that I can make a ministerial decision in order to pay the parental benefit to
That
people
was going to be
in
my
those
next question, actually,
situations.
because I know that this has happened before. During COVID, I campaigned on this for parents who were small business owners and were on parental leave and thus couldn't access the COVID support. And I know that the policy was changed as a result of my campaigning. So is there not a way that you can change your policy for certain people? For instance, small business owners who have been on maternity leave, perhaps?
It depends on the legislation and then what I have got the legislative ability to be able to do. So in the case of that home carers allowance example, I have the ability as minister to take those ministerial decisions, but when it comes to the parental benefit, because I asked this question the other day, because I do find it frustrating when you can see something that needs to change.
I would have thought you had some discretion there, though, on a case by case. Do you not?
No, the advice I got given was no, I don't have the ministerial discretion to do it. So
Okay.
that is why I've going forward with those changes, but not the home carers allowance change.
Okay, thank you.
Just a different tack on the Social Security Fund, and the recent actuarial review has shown apparently improved financial projections. Do you know what factors contributed to that, and are there risks around that? How certain can we be that that's not going to get changed to the negative again?
I have to say that's where I would revert to the investment specialists for advice as well, and also the Treasury Minister, because I think when it comes to investments and everything in the Social Security Fund, we've got a shared responsibility there. So that's not my specialist subject, but I'm quite happy to arrange a briefing with the specialists about that.
But do you anticipate, because of the, do you anticipate as an outcome of that you could change benefits because there's more money in the pot?
I just can make a point about the actuarial review. So one thing that is always included are a variety of other scenarios. So in terms of investment income, there'll be a central assumption, then there'll be a better assumption and a worse assumption. And then, so what you're looking at is the range of kind of outcomes you might get. Then you're looking to see what would happen if, you know, your investment income wasn't quite so good and there was more people than you thought, or different kind of things put together. And then you look at the Social Security Fund as a whole, and you see it looks pretty strong, even with some of the negative, the more negative kind of assumptions being brought in. So the Minister's quite right. Her team don't control the investment strategies. That's done through the Common Investment Fund and specialists in the Treasury. But we can say that the Social Security Fund is in very robust position. Internationally, it has a very good, that its reserves are, we were up to almost 8 years worth of reserves. There was a fantastic amount of reserves. You know, you could run it with 2 years. We certainly had 8 at one point. I'm sure we still got 8, but we're around 7 to 8 years worth of reserves. Yeah, that's a very, very good position. We can be very confident that we can pay old age pensions. We have got some increases in pension age going through at the minute. We're not quite halfway through a planned increase from 65 to 67, but we're not looking for any further increases beyond that. And the contributions and the pension rise each year, kind of pretty much in line with each other. So it's a robust and stable system. So
you're not planning any changes?
Not planning, no.
Okay.
The Minister's looking at some interesting kind of issues around how people get their pensions. So there's some useful things to be done, but big picture stuff, it's pretty stable.
So there is some work around flexibility around contributions and pensions, and as Sue quite rightly said, I'm not looking at extending the pension age any further than what's currently planned.
Okay.
I think we've done that effectively. Moving on to the HIF.
Okay, thank you. Minister, I have some questions about the health insurance fund. Given the fiscal policy panel have projected that the fund could be exhausted by 2030, what actions or reforms are you considering to ensure the sustainability of this fund?
I think at the moment, as I stated in the Assembly, I don't think that there will be any action within this current term of office. We're very aware of the need to be undertaking action in future years around the sustainability of the fund. I think that needs to be done in conjunction with the Health Minister as well, and the work that the Health Minister does around the whole environment around health. And I think my role at this point in time is to work in conjunction with other ministers that are working in that area of health to ensure that actually what we've got is a fit for purpose and well-funded health sector, which includes primary care and the pharmacies that are currently supported via that HIF fund. But that needs to work in tandem as well with the bigger health.
So it won't be addressed during this term?
I have no plans at the moment to make any changes.
Will that not compound the problems, given that 2030 is only 6? Yes.
Can I just make one point of clarification? The FPP have misquoted themselves or misquoted the budget. So on one page of their report, they talk about 2030, and then later on they quote accurately the budget, which says in the early 2030s.
Okay.
Yeah. So the fund at the by 2028, which is what we got the figures to, is 67 million. Just see over my screen.
Okay.
So it's not going to go from 67 to 0 in 2 years.
Right. So, but still, let's say it will be exhausted within 6 to 10 years. That's still
That's fair.
not very far away. And don't you agree, Minister, that urgent action actually is needed to prevent that happening?
I think it needs to be looked at in the round, along with all of the pressures that we have on health, and that's something that I will be doing in conjunction with the Health Minister.
Okay. Can you be more specific about what kind of pressures and how you see them being mitigated?
Not at that point in time, because there is ongoing policy work being done in health as well.
I guess what it looks like from the outside is that you've brought in changes in line with your priorities to reduce the cost of GPs. That's steepened the curve in terms of reducing the money in the health insurance fund, but you're not going to do anything to address it.
I think I'd revert back to Sue's. Yeah,
Council of Ministers.
I would revert back to Sue's advice around where we are with the fund, but also I need to take a longer term view that doesn't just look at the HIF, but also looks at where we are with health in general. But that really needs to be done in tandem with the Health Minister and the Health Minister's team as well.
And it's the Health Minister's team that's leading the work. I think that's the point we're making, is that the Health Minister's team are acutely aware of this issue and are looking at it, and did lots of good work in the last couple of years on understanding the health costing across Jersey as a whole. And they're now looking at kind of big picture strategy, and then that'll kind of roll back into funding. So the Social Security Minister's role is to support the Health Minister's team in that work, in the big piece of work.
You would be happy to see the HIF move out of your control ultimately?
I think that the HIF needs to sit in the best possible place for it to be managed effectively, but also to ensure that our health system is working together in a coordinated manner. Now, at the moment, we're able to do that. I have a good working relationship with the Health Minister. We're both very aware of the importance of the use of the HIF in terms of, people accessing primary care, and being able to afford to access primary care can save money further down the line in the health system. But I think it does need a whole system approach across health, and I wouldn't be adverse to it changing minister if that was the most appropriate thing to happen.
We may send some of our questions on in a joint letter, in fact, then if the responsibility is between yourself and the Health Minister. How many of these do you think?
Let's see. Shall we move on to the Social Security?
I think we should, yeah.
So one of the proposals in the budget concerns the purchase of the government's new headquarters. What makes the investment, £91 million in that, a good buy for the government? A good buy for the fund?
Yeah, I think it's really, really important to separate the decision around purchasing as opposed to leasing the site, which is not within my area at all. That's a separate Treasury decision from then the decision around it being a good investment for the fund. I did challenge that at the time. I think also the important thing to recognise is that we don't have ministerial oversight or public oversight over the remainder of the investment of the fund. So this one's quite an interesting one because it does get that public oversight that potentially other investments aren't getting. At the end of the day, I had to seek advice from our investment managers around this being the correct investment for the fund. I think it's also important to note that this isn't the first time that the fund has been used to buy property, because of course it currently does own Philip Lefevre House. So this isn't precedent setting. That's not to say that that's what makes it a good investment. I'm not the investment manager and I do have to rely on the investment advice. And again, this is one of those areas where myself and the Treasury Minister have dual responsibility to ensure that the funds are being invested correctly and appropriately. So I did give due challenge, I think, when the idea was first mooted to me. But I'm also conscious that I'm not an investment manager and don't have those skills and qualifications, and we do need to make sure that we have suitably qualified people making those decisions and giving the right advice.
One of the issues that it raises potentially, and you mentioned Philip Lefevre House as well, is the amount of assets being held in Jersey, which obviously could be seen as a good thing, but if it became overbalanced in terms of Jersey held assets, then the fund becomes very vulnerable to the Jersey economy. Is that something that you've considered?
I'm not responsible for the overall balance of the funds and the investments. We pay people that are much more suitably qualified to do that. My understanding is that it's a good thing to balance those investments across Jersey and overseas. But I think the right people to be asked would be the investment managers. Ultimately, Treasury are responsible for those investments.
Are you asking them? Because
yeah,
we're just the scrutiny panel. You're the minister with responsibility.
That's the level of challenge that I do give those Treasury officials as well. And I was very keen to ensure that the decision around purchasing the site as that being the right thing for government was taken differently to the decision as to whether it was the right investment for the fund. I think it was really important to separate out those two decisions and make sure that there was no conflict of interest in relation to those decisions as well.
Were you aware of any risks being identified around that purchase as a fund investment? I mean, when you raised this with investment officers,
I was told that actually it was a safer investment because we know who the lessee is, as in the government of Jersey, which is a very good, safe, sure bet if you're leasing out a property. So that was the assurance I was given with regard to return for the fund.
and in terms of how it's obviously going to generate an income, and that's presumably one of the purposes. That income, is that going to increase in line with inflation? I mean, what's the mechanism by which those rent reviews happen, given the relationships here are all government ones?
I haven't yet had sight of any of that documentation. The building is actually still under the ownership of Dandara, so all of those negotiations are actually still ongoing, and I don't think it would be appropriate for me to comment on that at the moment.
We may follow up with some written questions on that, if that's okay.
Thank you. I'm going to ask some questions about the long-term care fund, which some of it is linked to the questions we've already asked about the health insurance fund. The budget on page 83 states that action will be needed in the next few years to enable the balance of the long-term care fund to continue to increase. And you've stated in the budget that you would keep that under careful review in 2025. What does that look like, and what actions will be associated with that?
I think it does depend on what we get from actuarial reviews and the advice that we get in relation to the fund. I'm conscious that really how we raise funds for long-term care fund and also social security is linked, because it's contributions linked, is ultimately actually a decision for the government and the States Assembly. The States Assembly during last year's budget debate rejected an amendment to scrap the cap on social security contributions. That was something that I had supported, but the Assembly has rejected. For me personally, I would like to see I don't want the percentage going up for ordinary everyday working people, but ultimately that's a broader decision for the whole of government and the Assembly.
Would you not want
politically, my party has taken action to try and resolve that. I think at the moment we need to look balanced, given that Assembly decision not to do that. That we need to look at other ways in which we can get more funding into the fund that is ultimately going to be palatable to the community and the Assembly.
I think that was going to be my next question, whether you were considering proposing an increase in the contribution rate, but you're not considering that across the board. Is that right?
That's not being considered at the moment.
Okay, but in terms of Assembly decisions aside, I think that was, yes, this current term of office, but different makeup of the Assembly. Is that something, raising the cap, is that something that you as Minister are considering bringing to Council of Ministers or to the Assembly?
That would be something that I would consider bringing into the future.
Okay, and
You mean after the next election, or before?
It's not under current consideration. I think we need to see where we go following this government budget, and then looking at where we are heading with the long-term care fund. But it may well end up being something that's an election issue as to how that's done.
But would you say there's potential for it to be discussed by Com in perhaps the final year of this term?
I think there's always potential for ideas to be taken to the Council of Ministers.
Coming at it from, can I ask a question?
Yeah,
Just coming at it from slightly from the other angle in terms of the care fund, is it performing its function as it should for the customer, if you like? Are you aware of any problems in terms of the rates not being high enough, of the complexities around the funding formulas and so on? Are there issues to do with the actual management today of the fund that you're aware of and addressing?
So we'll be briefing the panel in private around some work currently being done around the domiciliary care aspect of the fund. But if I take away from the technical aspect and talk about how the fund's working for individuals, I know that the team has done a lot of work around improving the communication on the website and the booklets that are given to people once they have come into the department. What I've asked the team to do is to look at how we can communicate better in the public realm about what the fund's for, what it does, and what's the entry points to the fund, because I think at the moment it's not well understood within the community.
I think there's a lot of confusion.
And there is a lot, I would agree with you, there's a lot of confusion, and it's my role as Minister to kind of lead on kind of trying to make that, make it more understandable. So I have asked the communications team to undertake that piece of work. I think also the co-payment aspect, the ability to co-pay for care, is not necessarily understood by people. So, of course, long-term care can pay for, the kind of basic level of care, but care providers may well provide other types of level. People might want to pay for sea view if they're in residential care, for example. So it is quite complicated the way that it works, and my email inbox is very often contains emails from people that are asking questions about long-term care. So I am keen to get all of that clarified, and of course continue to work with both the domiciliary care sector and the care homes as well, to ensure that people are getting what they should be getting from the fund, and that it continues to work for people, and it works better, in fact.
So that addresses the point of access to the current funding, but the point I've heard, certainly from some care providers, is that the levels are too low for some situations, and I wondered if that question was under review as part of what you were doing next year.
We're currently in the process of finalising a piece of work in relation to the domiciliary care market, so that's where the focus has been to this point in time. And then, so once we've resolved that, then perhaps that'll be the time then to look at the residential care market.
And how does that link with the work on the income support system? So in the budget you mentioned that system could be used to support those who are receiving care at home.
Sorry, I'm just trying to follow the...
So in the budget, it mentions that additional support within the income.
Oh, is that the care
system.
needs at home?
I think so, yeah.
Okay,
I
so
think you may have covered some of this already.
yeah, so that was a separate piece of work, and that is for people who are on a long-term care package and are also income support claimants. What that does is recognise that there are additional costs to having somebody at home who is on a long-term care package. So yeah, I was pleased to be able to bring that and be implementing that as Minister. I know that, as with everything, there's always more work to do. And I think, linked to that is I'm also really pleased that we managed to deliver the wound dressing scheme, because that makes a real difference to people. So I'm always keen to look at where there might be gaps in provision that we should be filling.
Sure. And going back to care homes, in terms of commissioning care homes, how is that kind of funding allocated by your department?
That's quite a technical question, and I think it...
So, the long-term care fund creates a benefit. Benefit goes to individual people. People absolutely have a choice to choose their own care homes, and that's where the minister talks about co-payments. People often choose to go to a care home which has got a slightly higher fee, and they'll pay some extra towards it themselves. A long-term care fund will support most of the costs, and you'll pay some extra. So the Customer Local Services doesn't commission with care homes in the way that you might see contracts and spot purchases in the UK through local government. So I do know that the Health Department is very keen to kind of look at the way in which services are kind of provided in Jersey as a whole and how government's money spent on that. But the long-term care benefit is a bit different in the sense it's not directly commissioned.
I think
Health do some commissioning directly, but only in kind of the most cases which need the most amount of care, unusual ones.
that is one important point of clarification, is that it's the money is there for the person. The person has the choice of where to go. Obviously, the care home then get the payment directly.
We quite often pay the care homes directly because that's a straightforward, that removes
It's the
bureaucracy.
Care Commission that licenses
Yes,
care homes
it is.
and allows them to operate and so on.
Care Commission is the regulator, yeah.
Okay, so you mentioned different levels of need. Where there's a really high level of need, is that covered just by the long-term care fund, or are grants going also to care homes that are providing that kind of care?
So the long-term care scheme has always operated with a floor and a ceiling. So there's a level of care which you might need a little bit of care, but it's not enough to kind of get in. It's not the entry level. Then there are 4 levels, 1, 2, 3, 4. And there's a top level. So the long-term care fund will pay, it's in about £1,500 a week, maybe maximum. So quite a source of money, but there's absolutely a maximum. There will absolutely be a small number of people whose care needs are such that it's £2,000, £3,000 a week. So the long-term care fund is not set up to deal with that. Health retained some budget to do that. That goes to a special panel that look at the cases one by one. So it's individual cases, individually looked at, yeah? So that's, you'd always have to do that, yeah?
And that's with the health minister, is it?
And
Yeah.
that money sits with the health minister, yeah.
There's a lot of work to do around aligning services so that it can all work seamlessly.
How does that work then between your two departments? And is it working?
Oh, no,
They
that
work
works.
really-
That works fine. Yeah,
really
yeah,
closely
yeah,
together,
yeah,
yes.
Yeah. And so you just told me. Sorry, the maximum fee is we pay £1,363.95 is the top level at the minute. So just under £1,400 a week.
Okay. And the grant funding that goes to care homes that provides that higher level of support, is that on an annual basis that they would receive that money?
So you said grant funding, so I'm not sure, you need to talk to health about that, but that's a placement being made by a placement panel on a case-by-case basis. They will negotiate an individual package with the care home. The person will still get their long-term care benefit. It will max out at just under £1,400 a week. So the first £1,400 we paid for through the long-term care benefit, and then the extra, say if it was £2,800, the other £1,400 we paid by the health department.
Okay, sure. Do you want to move on to the...
Yeah. Social security benefit overpayments. Are you in a position to provide the annual figure for writing off benefit overpayments?
Okay, I'm just going to get the right figures for you so that I've got
15.
50. Okay, thank you. I don't want to give you the wrong figure, although I'm pretty sure it's in my head. So far in 2024, the policy change that I made, which was around writing off administrative errors,
Yep.
that has been a write-off of just under £50,000. Just to put that into context, the expenditure to date has been around 60 million.
From overpayments?
No, the expenditure to date altogether is 60 million. The expenditure on the writing off of those administrative error overpayments is just under 50,000. Okay. I was just putting that into context. No, it's not. I think the really good positive thing is that the scrutiny review and then the subsequent work that I've done with the department has really brought this to focus for the department, and I'm in constant dialogue, and I'm really pleased with the work that Sophie's been able to do with the department around trying to reduce overpayments as well through. So we're hoping to reduce the overpayments by up to about 50% through writing off very small overpayments that may well have arisen because somebody was a day or so late in notifying the department in a change of circumstance. Because I can imagine if you're changing your circumstance, such as moving home or moving job, front of mind might not be, I've got to tell Social Security Department today. Mm-hmm. So dealing with those.
Do you not worry that you're creating an incentive for bad behaviour, in a sense? You know, that by writing that off, you're basically saying to people, look, don't worry, in a few days, maybe a week, we won't bother.
I don't think so. We're certainly not sending that message out to people. The message out there is loud and clear. But I think a very small bit of leeway, which then saves us on admin time chasing up those overpayments, and also saves on stress for people. That is worth that, and my understanding is that process is working really well within the department. But also, we were chatting about this just yesterday actually, what it means is that the department are now continuously improving their processes. So now, because that focus has been taken to look at the overpayment situation, where people are thinking differently, I think. But no, the aim isn't to drive change in behaviour of people claiming income support.
But it is a different category. You started off writing off payments that were made by administrative error. This is error, in this new case you're talking about, this is error by the applicant. In other words, they should have let you know, and they didn't. But you're saying we'll
Or they may
forget
have
about
put
it.
something in the post and it may have taken a couple of days,
But revenue,
so-
for example, wouldn't take that view.
No.
The tax office are very unlikely to say.
They may not, but I'm dealing with people who are on very low incomes, who have received an amount of money and probably not, well, certainly in the case of administrative errors, but when we're talking about very, very small, days worth of overpayment, actually the administration involved in kind of processing and chasing those up would have come at a cost as well. And also what comes at a cost is the mental health side of the cost to the people. When you are living week to week, a few pounds that you have to pay back can make a difference.
In cases of overpayment due to administrative errors, what's the cut-off point in dates? How far back did you go in terms of allowing those? Or was it from the point when you changed the policy?
From the point at which I changed the policy. I can't go back and change the policies of previous ministers. But of course, you've been dealing with some of those cases and looking at those. But of course, as we're catching these, we're able to fix the root cause of the issues in the first place. So I'm actually really pleased with the efforts that the department has made in this area, but also the results there as well, because resolving this situation will enable us to resolve what becomes a very stressful situation for low-income earners. And then, like I say, actually, the levels of stress and people having stress costs government money as well. So,
Do you know that of that 50,000, do you know how many people that involved?
I am looking to see if I've got the...
39.
So we've got 39 errors there.
Okay. And, was there one jackpot in there, or that's facetious? It wasn't a jackpot,
Yeah.
It was an overpayment. But
No, it
you
wasn't.
know what I mean.
I wouldn't consider it a jackpot. I think in those circumstances, what has happened is if it was an administration error, my understanding is that the person would have received a letter telling them that they were entitled to something. They'd have received that money into their account. They wouldn't have known that they'd received more than they should have received. I wouldn't want to go into whether there's been any particularly large, because I think that would go into an individual case.
Right. Understood.
Sure.
You say it's driving improved behaviour within the department. Has it led to identification of sort of outdated IT systems or sort of functional systems that are just not working as well as they should?
We already know that our IT system is outdated and is well overdue replacement. So I'm pleased that work is well underway to replace that system. So no, it's not necessarily the systems, it might well be processes, but I mean, I think I want to be careful around this, because I think the department staff always worked incredibly hard to do the right thing. So I do want to make that point as well. But it's the moral thing about going back to somebody who's on a low income, is living week to week, has received money that they thought they were due, because they may well have received correspondence telling them that they were. They've spent that money in good faith. And to give them a bill off the back of that, I think, is fundamentally wrong. And that's what's been stopped.
Was there a cut-off in terms of total amount, a point where you'd say, well, I know that was an error, but, it's such a big sum of money that we can't let that go through? Was there some threshold?
No, we've not put a threshold in place, and I would hope that errors are being identified in a swift enough manner that they are keeping at a low enough level. But you know, again, it's around keeping that focus and saying this is actually where we needed to improve. The department has improved, so I think that's actually a good news story.
And just the final question. You say it's improved. Is that borne out by the data showing that there was more repayments due to administrative error at the beginning of the period, and there are now lower repayments due to administrative error now with 7, 8 months in?
I think it's from what I'm hearing directly from the department about changes that are being made to processes because errors are being spotted. I don't know if you want to add anything to that,
Yes,
Sophie.
I would say, I mean, previously this wasn't something that we measured, so it would have been hard to have given a figure for sort of in historical years in about reasons for write-offs. We wrote off, but we didn't sort of we couldn't easily report on the category of that. So it's not so much about the numbers, but I think certainly from a cultural perspective in the department, actually whenever there is a all write-offs due to administrative error are looked at at a senior level, but also then it's actually looking at from a learnings perspective. This isn't about a kind of blame as to why something's happened, but actually looking at, right, well, how could we reduce this risk going forward? Are there elements that we need to actually bring into our training? We have a really comprehensive training programme within income support, and we also have refresher training. So it's actually looking at opportunities to be able to say, okay, you know, what's happened has happened, but actually how can we bring things in to reduce that? And I think that's something that as a department we're very on board with, really trying to minimise this, both for the individuals concerned, but obviously from a budgetary perspective as well.
And will you report annually on the total amount of overpayments?
I'd hope by the time we get our new system as well, we'll resolve the issue. I'm happy to report. I think that is important. I think what's also important to clarify is whilst that's a change in policy, it's not the first time that some overpayments have been written off by the department. So they would have written off some overpayments in the past in extenuating circumstances. So I just wanted to make that point that it's not an entirely new thing.
Thank you. Minister, I'm going to ask you some questions about the compensation award scheme, and you'll be aware, of course, that in June the Employment Forum presented a report to you with some recommendations, and the panel have noted also your report in response, where you have accepted all of those recommendations, which I think was in August. I'm going to ask some questions about some of those specific recommendations. First of all, the increase in the maximum compensation limit from 4 weeks' pay to, I think it's 8 weeks' pay, or there's some other flexibility, isn't there? Could you talk about why you decided to accept that particular recommendation?
I think with that and all of the recommendations coming from the Employment Forum, there was a clear rationale. They had done their work to engage with stakeholders from both employer and employee sides. When I met with the chair of the Employment Forum, I was content that they'd taken a measured approach. I may well have wanted them to go further in some instances, but I think in accepting the recommendations of the Employment Forum, I'm acknowledging the fact that they have done that piece of work, and I was satisfied when I spoke through all of the recommendations with the chair that the right amount of due diligence and the right balance had been struck at this point in time.
Do you think that there's a potential in future to increase that, or indeed is there anything that would link it to RPI or average wage increase, anything like that?
I think the thing is what we can't get into a situation of is where levels kind of stagnate and then they become that they're not worth. And if you take, I think the maximum level for the discrimination breaches was, you know, very superficial, really. So raising it for me is quite important as a deterrent, because you hope that employers won't be breaching the discrimination legislation. But I think when it comes to what you're saying around further reviews and increasing, I think that it is important to be revisiting that on a regular basis. Although that's not a conversation I've had with the officer so far, so I will. That's the important.
It is in the draft. So they're always being drafted at the minute, and there are two types of payments that we're talking about. One is a payment related to your normal weekly wage, yeah? So that one is fine. You can say 4 weeks, it's 4 weeks a day, or 4 weeks in 10 years' time, it will still make 4 weeks worth of pay, yeah? So that one's a nice, easy one. That's gone up from 4 to 8 weeks. So a bigger range to work within. Lots of times it doesn't even, the award isn't 4 weeks. It might be 2 or 3 weeks, but now you can go for anything from 0 up to 8 weeks. So that gives you lots of room for manoeuvre for the tribunal. The second one is where there's monetary limits. So I'm sorry, when you see the law drafting,
I haven't seen it yet.
You'll be pleased to know that it's in the law. It's going to say, subject to state's approval, that the minister has now an obligation to review the monetary values every 3 years. So it doesn't say put that by RPI, it says review them every 3 years. So that gives you room for manoeuvre again. It's what you think, what people think at the time is the right thing to do. So that's the current...
In that case, I don't need to instigate that discussion, because when I see the law draft...
I've anticipated you.
Thank you. And there are some legislative amendments required. What's your timeline for implementing those?
We're on it right now.
Yeah. So the law drafting has, the substantial bit's been done. As ever, there's always little bits and bobs to kind of like the tidying up bits. It's primary law, so it needs human rights review, but hopefully you'll be able to lodge it soon, within a matter of weeks, yeah.
So before the end of the year?
Yes.
That was the aim,
yes.
Where we can get things done quickly, we are.
Yeah, I can see that. Thank you. So in terms of the assessing the impact of the new compensation limits, what's your plan for ensuring that it is actually at the right level?
I think that's what we're going to have to remain in consultation as well with Jax and the tribunal service around, to see what the effects of these changes are.
Do you consult with unions as well as Jax?
I do consult with the unions as well. Obviously, the Employment Forum itself consults broadly, but I do, and I did promise when I was a minister that I would consult directly with the unions and employer representatives as well. But it was a good piece of work that the Employment Forum did. They're currently working on the piece of work that needs to be done to inform the whistleblowing legislation that the Assembly passed in principle last year, I think it is now. They're being kept busy despite not having to consult on the minimum wage this year.
Yeah. And the tribunal system, do you agree that it's been underutilised in the past, and what of these new measures do you think will most increase accessibility of the system to people seeking fairness? And
yeah, it's interesting because these measures aren't really about accessibility, but I think that there is work to be done to ensure people know their rights and know that they have the right of recourse through tribunals. So
is there anything about the comms and communicating that in there? I don't.
So Jax will do a lot of communication outwards to both employers and employees about employee rights and employer obligations. Of course, the trade unions will be, and I would, as a trade unionist, always say you're always better being a member of a trade union.
I agree with you there.
The tribunal process can be testing, and I think it's always useful to have an expert by your side going through that process. But to come back to your point about accessibility, I'm quite
just awareness.
Yeah, and awareness. Yeah, I'm quite happy to take that back and have conversations with Jax and the Tribunal Service about how we can ensure that we're doing what we can from a government level about raising and increasing awareness about the right of recourse through the Tribunal Service. I mean, I know one of the areas that actually one of the unions wasn't best pleased with me about was the not increasing the time limits.
That's one of my next questions.
Yes, and that is actually in my manifesto as well. And I decided in this instance to take the Employment Forum's recommendations, and I had a discussion with them about this because on balance they were actually saying that doing that might have a negative consequence as well as a positive consequence in terms of encouraging employers to elongate their processes. So I'd need to do some more thinking and more work if I was going to make that change. But I do know that some union representatives feel very strongly that they should be extended. So I am alive to that. But obviously it seemed most sensible and quicker to accept the Employment Forum's recommendations, get on with that, because I think it's getting good things done.
Yeah, sure. And just going back to the awareness, do you think that enough people who are in employment actually know about these rights? And I know that Jack's do a wonderful job, but do you think that perhaps social security itself has a role to play? Are there touch points in where businesses are interacting with your department that you could actually communicate these rights to them, or place an obligation on employers to commucate them?
Funnily enough, I was thinking about exactly this the other day, but I haven't had the conversation with officers yet. So because I was thinking around what role do we have as government to put out information and details around employment law. Rights, you know, we've got lots of social media within government, so that was the type of thing that I was thinking does need to be done. So
will you let us know how your plans evolve for that, please? Thank you.
I think it's incredibly important that people know what their rights are.
Okay, thank you. And in terms of one of the other recommendations, the tribunal recommended that judgments should be anonymised. How will this be of benefit to potential claimants?
I'm just trying to get my headspace into that. I think because, of course, the tribunal judgments, they go online on the website, they're really easy to look up. Potentially that then opens up claimants if they're then looking for other employment. I don't think employers should
Disincentive, isn't it?
Yeah. So, and I know Jersey's a small community as well. So the anonymisation was seen as a really important thing to be able to do, so that it protects people who are bringing claims into the future.
Yeah, and
but
as
you
a
are doing the just to be very clear, the law draft at the minute is around the monetary awards and one other small thing, yes, and then the work on anonymisation and some other things. And
that's more complicated.
Is going to go next year, yeah. So we didn't want to hold up the increase in the money because that's a more straightforward thing to do.
Yeah.
But the other things will be linked with probably, depending on resources and everything, a more thorough review of the tribunal rules. So they talk about access to the tribunal, stuff like that. Yeah, it's all part of a project for next year, subject to everything being able to fit into the plan.
Thank you. Could we have in writing for each of these items your time frame for implementing them? That would help us to keep track. Thank you. What kind of increase are you anticipating in terms of people accessing the service as a result of these changes?
And I think this comes down to that communication piece, because I don't think the changes themselves lead to an increase. I think that there's other work that then needs to be done to ensure that people understand that, hey, you know, once the bit about anonymisation is complete, that yes, that's the case now. but also that piece on communicating rights and working with all of the relevant stakeholders around that, I think is really key to that increase. So I haven't got in my head what the increase might look like, because I think that's linked to other pieces of work.
Yeah, okay. Okay, thank you.
Of course, I would hope that employers are doing their best to be good employers, and that in an ideal world.
It was suggested that tribunal fees be introduced. Do you worry that that might reduce access?
I think, and I'm just trying to remind, that was in the case of where there might have been a vexatious,
So
vexatious,
okay, so just
And I think the bar for the tribunal deciding that something was a vexatious claim.
Yeah, okay.
Discrimination law has been, I think, from what we understood from previous quarterly hearings, has been paused due to work on other legislative work streams. Can you update us on where you are with that, and when, if at all, you expect it to restart?
At the moment, the employment legislation is taking kind of the priority piece of work. So there wasn't any plans at the moment to have those changes to discrimination law. I think at the last hearing, I said that I would undertake to find out from JACS, because we were talking about religious belief. JACS have come back and said that they aren't getting any inquiries related to religious belief. So at the moment, there doesn't appear to be a compelling reason to bring that forward before all of the changes to the employment law that we've just discussed. But of course, as I said in the last hearing, if an issue becomes apparent, I'm always happy to kind of look at what we need to shift priorities-wise.
Yeah, just picking up on the potential for religion and belief to be a protected characteristic. Obviously, the discrimination law also covers provision of services, goods and services. So how would you establish whether there was a problem in that area as opposed to employment?
And I think this is why that's such a change to the discrimination law would be a significant piece of work that would then require significant consultation as well. Yeah. So that's why at the moment that focus is on that work that we need to do with regard to the employment law, getting that done, not taking too much on at the same time that we then don't deliver anything. So that's the reason I've been quite realistic around where we are and the workloads. And I know, going back to our conversation earlier around budgets and resources, I have to be realistic about what we can do, but also the budgetary constraints within government as a whole, and not implementing too much too quickly all at the same time.
Do you have any sense of whether you will get this done in your term, in this term of office?
At the moment, it's not on the ministerial plan. Obviously, once we put out the business plan as well, I don't think it will be on there because we're not seeing it as an issue. There are other things that are issues that need to be resolved, that need to take precedence at the moment. But as I said to the panel last time, if you are aware of reasons why it should be brought forward, I'm more than happy to hear that.
I wanted to ask about another characteristic that I'm not sure if you were considering it or not, but other jurisdictions have it, and that's carer status. And you mentioned that JACS weren't aware of any problems in employment in terms of religion and belief. But when I looked at the JACS statistics, I think it's fair to say that carer status is something that leads people to experience considerable discrimination in the workplace, and especially given that we have the equal parental rights. Can you comment on that and whether that's something you could address?
I think there's lots of work that we need to do around carers in terms of parents and informal carers as well. That does need to be across government work. I did I did bump into Deputy Barbara Ward, who's the Assistant Health Minister, who I know this is one of her key areas of interest this morning. So I did say to her this morning I will get together with her to discuss how we can better support informal carers into the future as well. I am happy with the employment legislation in terms of flexible working, but I know that there's other things that could be done within employment legislation that may provide greater protection and flexibility to carers, but it's around getting that into the work programme and work stream, and the realistic nature of being able to implement it, because I'm always conscious that we don't have statutory sick leave in the legislation. To my mind, it would seem appropriate that when that is handled, we look at whether there's carers leave at the same time. At the moment, we're in the middle of raising the minimum wage, and we're working with employers to ensure that we are able to do that in a sustainable way. I think it would be difficult for employers if I started then implementing statutory leave at the same or a similar time. So I do need to take care in balancing how we approach that, but there may well be softer things that we can do within government that don't require legislative change that also provide more support to carers as well.
I'm interested, you've said that very clearly that discrimination law is on the back burner for reasons which you've clearly put out there. But the things that have moved into the priority phase, are there things there that we haven't talked about here that are moving into view as priorities in the next year? We've
covered quite a lot of ground, so I'm trying to remember what's on. I should have actually printed out the spreadsheets of the other priorities. So one that comes to mind immediately is we're currently looking at income support. So some of the policies around how implementation of income support, once the officer has kind of completed some of that work, then we'll be picking up on the long-term incapacity allowance. At the moment, the way of being assessed for that is quite complex, it's out of date, and it needs updating. So that's the kind of next key area to pick up as well that we haven't discussed as yet today. And I think that's really important because it does affect a lot of people, and that also aligns with some of the work that we're doing with the disability strategy as well. So I'm also chairing the Disability Strategy Advisory Group. So I think it's really important that me as Minister is chairing that group, and the sector seems to be responding well to that. We have been in the process of basically prioritising work that needs to be undertaken. So the team there have they've been working really, really closely with the team at IHE on the accessibility of disabled parking spaces. They're also going to be doing some work around inclusion. I think it's inclusion champions in all schools. So some really important work that's happening in that area as well, which would be great to brief the Scrutiny panel on in more detail at another time. I'm just the free GP visits for students is in the middle of implementation at the moment. So that is really important for me to be able to implement, because that was a state's decision as well. And I'm just trying to think what else I may have missed. Can you think of anything, Sue or Sophie? Yeah.
Sounds like a fairly full programme.
Something that you mentioned about flexible working earlier made me think of, I know that there are campaigns in other jurisdictions to make all employment contracts flexible by default rather than employees having to apply for that flexibility. Can you give your views on that as a policy?
That's not something I've given any thought to. I'm just trying to, because I think there'd be risks and benefits to that, so I'd need to go through that. What I wouldn't want to avoid, what I would want to avoid is risking putting people into more precarious work situations by taking steps that are too far within the employment law.
Yeah.
So I think there's always a balance with employment law to ensure that we've got the right protections in place, but also we don't go so far that actually we run the risk of putting people into insecure employment.
Yeah.
So, yeah,
Maybe
but I'm
we
always
can have a
open,
chat
always
about
open
that.
to new ideas.
Yeah, sure. Do you want to ask something?
I think we can.
Yeah, okay, well, we're a little bit early, which is unusual, but thank you for being succinct and clear with your answers and for all the information that you've shared with us today. It sounds like you do have a very packed agenda and lots of things being delivered and being planned to be delivered. So we will send a few questions that we would prefer to have in writing, so we'll send
Technical.
that one.
sort of nature.
Yeah, and follow up on some of the things that we've asked for as well in the hearing. But yes, thank you for your time.
Thank you.
And wish you luck with your policies.
Thank you.
Is there anything you'd like to add before?
No, I think we've covered quite a lot today.
Okay, right, I'll close the hearing. Thank you very much, everyone.
Thank you. Thank you.
Wait for the all clear.